There we go. So I'm pleased to introduce Jenna Swift to present today's webinar entitled The Power of Nutrition. Jenna Swift is a registered dietitian who graduated from the University of Alberta in 2015 with a Bachelor of Science degree, majoring in nutrition and food science and integrated internship. She also has a Bachelor of Science degree in biology from Thompson Rivers University. She now works in an outpatient clinical setting at the Cross Cancer Institute in Edmonton, counseling patients with hematological cancers. She teaches a provincial outpatient class for patients with all types of cancer, focusing on good nourishment while having cancer treatment and managing nutrition-related side effects. She enjoys going to new grocery stores, especially in other cities or countries, to try different fruits, veggies, and desserts. So with that, I'll turn it over to Jenna to begin the webinar. Thank you, Jenna.
Great. Thanks, Fiona. Hi, everyone. Thanks for joining me today. As Fiona mentioned, I'm a dietitian specializing in hematology in Edmonton, Alberta. I work out of the Cross Cancer Institute, if you've heard of that one before, if you're in Alberta. So I'm going to jump right in. Fiona mentioned that you can feel free to come off mute anytime. We're a smaller group today, so you can unmute yourself and let me know if you have any questions or comments or something that's worked well for you. Always happy to hear what strategies people are using. And then there's also the chat box here in Zoom. So if you want to put a message or a question or comment in the chat box, one of us will get back to you there as well. Okay. So just a quick disclaimer, I'm a registered dietitian practicing in Alberta, and I don't know your medical history or specific treatment. So do consult with your healthcare team if you're making any specific changes or specific questions to your treatment plan. And if you do need any help getting connected with a registered dietitian in your area, I'm happy to help with that after the webinar as well. And I'd like to acknowledge that we're learning and healing on the land that is home to many Indigenous peoples. I'm located in Edmonton, Alberta, Treaty 6 territory. For generations, Indigenous peoples have focused on healing and wellness by focusing on a balance between physical, mental, emotional, and spiritual well-being. The painting here, titled The Three Sisters, is by the Métis artist Perry of Fusion. The three sisters symbolize the crops corn, beans, and squash. A source of inspiration and guidance, the story of the three sisters speaks to collaboration and cooperation as they feed a hungry boy. As we learn about nutrition today, we might find guidance and inspiration like in this story. Quick outline, we're going to talk about why food matters, nutritional needs during treatment, treatment-related side effects, and then go through some common questions. Again, if you have specific questions too, happy for you to jump in and share those. Okay, so getting right to it, why food matters. When you're nourished, your body is better able to withstand toxicities of treatment and side effects are more manageable. Nutrition healthy eating goals may include maintaining your strength and energy, helping to manage side effects, which we are going to speak on quite a bit later in this presentation, help you to heal and recover from treatment, manage fatigue, fight infections, minimize weight and muscle loss. Eating adequate amounts of calories and protein helps to conserve muscle and strength so you can continue to do the activities that you enjoy. Regardless of body size, we know that weight and muscle loss during treatment can lead to worsening outcomes. Another goal, preventing and improving malnutrition, and then improving quality of life. So what does this look like? We know that nutrition needs change during cancer treatment, so let's review those. Extra energy. So your body may need more energy or calories than usual right now to help support your body's ability to heal from treatment. Energy comes from foods and drinks. Specifically, we get energy from protein, carbohydrates, and fat. We don't get energy from vitamins and minerals. Still very important, and we'll talk about those too. I do have a few tips for increasing calories. The one that comes to mind first is increasing portion sizes. That's not always easy to do. So maybe easier said than done. If you're able to, increasing portion sizes to get more calories. But if you can't do that, a few other tips, snacking between our meals. So having maybe smaller, more frequent meals or snacks. Having drinks with calories to help boost your intake. So that might be swapping out 1 cup of water for something like a cup of milk, smoothies, nutrition supplements, soups, as examples. Sometimes liquids just tend to work a little bit easier for people if they may be nauseous, maybe mouth sores, fatigue. Liquids can go down a bit easier, get absorbed and digested a bit easier. So if those liquids also give you your calories and protein, that's a bonus. Adding extras or calorie boosters, I'll call them, to what you're already eating can help increase those overall calories in a day. So, for example, if you are making, let's say, an omelet, could you add some shredded cheese? If you're having a peanut butter sandwich, could you put some margarine in addition to the peanut butter on that bread so that per bite you're getting more calories? Another example is an extra drizzle of salad dressing, maybe a tablespoon of olive oil into your soup, adding extra gravies, sauces, avocado. You notice that a lot of those examples are higher fat options. So fats give us the most calories or energy per gram. So that's why those come up so often. Could also try choosing higher fat dairy. So for example, if you're buying yogurt, I know there's too many options at the grocery store now for yogurt, but looking for something like a 4% milk fat yogurt or 9% even versus the 0 or the 1% milk fat yogurt. So you'll see a percent MF on the front of yogurts, cottage cheese, sour cream. And that's that indicator of what the percent milk fat is. So again, trying things like the full fat milk. So in the same volume of food or fluid, you'll get more calories per bite or per sip. Okay, I want to talk about protein next. Protein's needed for healing and repair of tissues, rebuilding healthy blood cells, supports the immune system, and helps to, of course, maintain our muscle. So during treatment, your protein needs are higher than normal. So getting enough protein-rich foods can help to slow or even stop the loss of lean body mass or muscle. And I'll give you some examples here. I've got a few pictures there, but examples of protein-rich foods are meats, poultry, fish often come to mind first, but there's lots of other options. So of course our meats, I've got a picture of eggs up there. Anything that's dairy containing, so cottage cheese is very high in protein, or sorry, dairy product, not dairy containing. Cottage cheese, like I mentioned, yogurts, and of course, if you've seen some of the higher protein yogurts, things like the Greek yogurts or skyr yogurts, they'll have written on there, higher in protein or Greek written right on there to indicate that they're a higher protein option. Cheese, milk, milk alternatives like soy milk, also great for protein. Nuts and seeds are some other options as well, or nut or seed butters, great for protein. Got a picture here of some beans, some lentils. Other options would be, I mentioned soy milk already, but other soy products, if you enjoy tofu, tempeh, edamame beans. So just yeah, a few of those examples of those main protein sources. We do recommend including a protein source at each meal and ideally each snack, just to help you meet those higher goals for protein. And the amount of protein you need does depend on your body size, the stage of treatment that you're in, your activity level. And make sure to consider your kidney status before increasing protein. So I have some numbers here that you can calculate, or I can help you calculate for the amount of grams per day of protein that you would need in active treatment. But just be cautious if you have any issues with your kidneys, your numbers would be lower than this. So it's a lower range just to help protect your kidneys. So you'll notice that I've written 0.8 grams per kilogram of protein for maybe the average person in the community, not on any kind of cancer treatment. Goes up when you're having active cancer treatment. So we have the number as 1 to 1.5 grams per kilogram of body weight, gives you a protein goal for the day. And that number is even higher if you have graft versus host disease. So up to 2 grams per kilogram in a day. So someone who is, let's say, 80 kilograms may need 80 to 120 grams of protein in a day based on that 1 to 1.5 grams per kilogram range. And then, of course, depending on body size, type of treatment, where they are at in their treatment, whether before treatment, during, after physical activity, that might help us determine where exactly in that range would be ideal. There are many backup options for, or alternative options, I should say, on the market now for protein, whether that is nutrition supplement drinks that are high in protein, protein powders, protein bars. I feel like they're adding protein to everything. So we often recommend a whey-based protein if you are doing a supplement type product, just because that has the most research in the area of muscle and strength rebuilding, which of course you are at risk of losing muscle mass while having active cancer treatment. So that's why the whey-based option is recommended. Of course, if you're maybe vegan, vegetarian, there's definitely other options. That's just the one that we often go to first. Okay, any questions about protein, protein sources? Reminder, I mentioned ideally a source at every meal. It can be tough to get enough protein in the mornings. So do consider if you're just having a muffin or a toast and jam, could you have that side of cottage cheese, or could you switch or add some peanut butter with that toast? If you're maybe you love oatmeal in the mornings, could you add some ground flax or crushed pecans in there? Maybe you use milk instead of water to make the oatmeal. So a few switches that way just to get that protein in the mornings. I do find that people often struggle with breakfast time to get enough protein in. It can come a little easier if you're one that has, meat and potatoes at supper, but breakfast can be a trickier one. Any questions about protein from the group? I don't see anything in the chat, so I'll.
No, not yet.
Yeah, no, okay. I'm gonna talk about fluids, hydration now. So most adults require 2 to 3 liters of fluid every day. So between that 8 and 12 cup mark. We do include all your fluids, except alcohol, I've noted on there. So water, juice, milk, soup, technically ice cream, jello counts, or coffee and tea also count. So I know there's always question of if there's caffeine in my beverage, does it count? But we do count tea and coffee in moderation, of course. So we know that high amounts of caffeine can interfere with sleep quality, with anxiety levels, heart rate. So the amount works out to about less than 3 to 4 cups of coffee in a day would be the maximum caffeine amount. But if you're drinking, if you normally drink a cup or two of tea or coffee in a day, we'd definitely count that in your total fluid amount. So be thinking about that, how much fluid you're getting in a day. We know that adequate fluids help to digest food, prevent constipation by keeping stools soft, help support blood volume to carry nutrients through the body, replenish any losses, maybe from diarrhea, vomiting, a fever. You'd have fluid losses there as well. If you are having losses like diarrhea or vomiting, we often recommend an oral rehydration solution or electrolyte solution to help replace those losses. So the electrolytes and fluids that you've lost through those mechanisms there. So this could be something like a low sugar Gatorade, which is the G2, if you've heard of that, Pedialyte, or making your own option. So we do have some recipes if you're interested, looking at things like using a regular sodium soup broth, or juices that actually have some baking soda or salt added. So basically making your own electrolyte drinks. I mentioned vitamins and minerals earlier. We want to aim to eat a variety of foods first before using pill forms of our vitamins and minerals. And the way nutrients act in the body may be different in food versus pill form. So you get the benefits of other nutrients, including fiber, when you eat the whole food. That being said, it is generally safe to take a once-a-day multivitamin or multivitamin mineral supplement. And we do actually need to take vitamin D daily in Canada because we can't get enough of this nutrient through food. So vitamin D is something that we do recommend, not necessarily any other one specific vitamin or mineral. unless of course you have a a low blood level of a specific vitamin or mineral that has been tested, or maybe you have a food allergy or intolerance that means you need to avoid a large group of foods. You may need to supplement that vitamin, mineral, or combination of foods if that's the case. But the average person really would only need to take vitamin D. You could do, like I said, a one a day multivitamin if you felt like maybe you weren't able to keep up with your eating, or that you didn't have a lot of variety in your diet based on how you've been feeling lately. It would be safe to take something like that. Again, we do recommend that you talk to your team before you start anything new, but that one a day multivitamin would be fine. A lot of it, if you are eating well, you're going to pee out a lot of that water soluble vitamins that are in there. So you definitely don't need to be taking a multivitamin, but it is an option. We do know that high doses of some vitamins, so in concentrated forms, individual vitamins can interfere with treatment. So more is not better when it comes to supplements or vitamins and minerals. It's been shown that high doses of vitamin C, for example, which has antioxidant properties, can actually interfere with chemotherapy and radiation. So more research is really needed to know about recommendations for safe doses of single vitamins and minerals, especially when it's in those concentrated or high dose amounts. When it comes to food, we're not worried about getting too much vitamin C because your body is good at absorbing what it needs and getting rid of what it doesn't. But when it is in concentrated form, such as pill form, powder form, IV form, we worry about those numbers being too high, especially when it's a product that has claims of immune support or stress control, which tend to be higher in antioxidants, which in theory protect all of our cells, healthy cells and cancer cells. So you can see how that can work against some of the goals of treatment. So again, just always asking your doctor, your pharmacist, anyone on your cancer care team, if there is a supplement or herbal product, vitamin, mineral that you're starting or thinking about using, just so they can check that there are no interactions or any negative side effects with that. So talking about vitamins and minerals kind of ties us into something called phytonutrients. Phytonutrients are naturally occurring compounds found in plant foods, so our fruit, vegetables, whole grains, beans, lentils, soy, nuts, and seeds. Phytonutrients give the food its color, flavor, aroma, and offers lots of health benefits. So, one being antioxidants. I know we just mentioned not getting high doses of antioxidants from food, or sorry, from pill form, but in food form, we are happy for you to get those antioxidant-rich foods. Um, Knowing that the body is great, again, at absorbing what it needs from food form. Phytonutrients give us our immune support, reduce inflammation, and are involved in many other functions. So just give you a few examples. You might have heard of lycopene before, which is found in tomatoes and other red fruits and vegetables, or beta carotene, which is found in sweet potato, carrots, other orange and yellow plant foods as well. So when I say variety, different colors is great too. So getting different colors in our diet from those plant foods. I recommend including greens where you can, if you have an appetite for it. So your raw leafy greens, cooked leafy greens, you get different benefits from each. So if you can consider having more greens in your diet, think about blue and purple fruit and vegetables for anthocyanins. Even our white vegetables like garlic, onions, potatoes, they have benefits even without those vivid colors. So I think some people might disregard them sometimes. Oh, potatoes don't give us much, but they give us lots of good nutrition too. So don't include those as well. Our plant foods give us fiber, which is helpful for heart health, bowel health, and feeds the microbiome, which we know is also linked to the immune system. Okay, I want to go through managing some nutrition related side effects. This was a list that I tend to get questions about, but if you have anything else on the list or anything else, sorry, that's been going on for you, nutrition related, happy to discuss it here too. They also have handouts if you need more information on any of these topics. For example, taste changes, we'll go through the basics, but if you want to kind of do a deep dive into what strategies might work for you for a very specific type of taste change, I can always send you a handout on that as well. Alberta Health Services has videos for a lot of these common side effects that I can send you to. They are just through YouTube, so anyone can access those. I can make sure you get the links if that's something you're interested in. So I don't know if anyone in the group is having any issues or has had issues with poor appetite. Excuse me, but poor appetite is one that is lower than usual for you, and it's a potential side effect of many different treatments. So um, a few strategies that I've got listed here, and I'll go through them. So thinking of eating as an important part of your treatment, maybe considering it, a prescription taken 3 or more times a day, if you find that that's encouraging for yourself to keep eating and drinking, is to have a bit more of a schedule or a plan. Some people that is helpful, but yeah, if you are affected by a decreased appetite, trying smaller, more frequent meals can definitely help. So you're not sitting down to this big meal, this overwhelm potentially of having to eat a certain amount in that sitting. So snacking in between meals essentially. So having smaller meals and then snacking in between. And then when we talked earlier about including, higher protein, higher calorie options, so then per bite, even though you're eating less in volume, you are able to keep up with your calories and protein needs as best you can. Limiting empty calories, so making every mouthful count. Empty calories might be something that doesn't give you much nutritionally. So um, if that's something you're doing, can you work? Maybe you're doing lots of, let's say, crackers. Crackers are fine, but could you add maybe some cheese on top or a bit of peanut butter? Is there anything that you could kind of incorporate with it so that you kind of a vehicle for the protein to just, like I said, make every mouthful count when the appetite just isn't there and you're forcing your eating already. If there's a time of day when your appetite is good, capitalizing on that, keeping your favorite foods within reach. Some people find that the certain smells of foods that you enjoy, like freshly baked bread, those smells can stimulate a bit of an appetite. There's been a bit of research that drinking carbonated beverages helps stimulate appetite. So that's something to consider. And drinking enough fluid so that we know that dehydration can cause low appetite. So just check in with yourself. Have you been keeping up with your fluids today? Is that something you need to be working on just to help overall appetite? And then distracted eating is on there. So we call this mindless eating. This is the only time the dietitian tells you to do mindless eating, but it might be helpful if you're maybe watching TV or chatting with family, or maybe you're reading, so that the focus isn't so much on your plate. If you're finding it's a struggle to get through a meal or a snack, that distracted eating can be helpful. Eating with others has been shown to help improve nutrition, as we tend to eat more in a social setting, if that's an option for you. Light activity, of course, can help. Some of examples are, walking, even folding laundry. So something that you're up and moving can definitely help stimulate an appetite. And then I mentioned before, treating your meal times like a prescription for 3 or more times a day, similar to setting, an alarm or reminders on your phone, or someone is calling to remind you, even a timer on your oven or microwave to cue you to eat. If the body's not telling you it's hungry, it can often be difficult to keep up with those meal times and get enough. So sometimes those external cues are necessary as reminders to be eating. And yeah, it's really difficult with poor appetite. We're telling you that your nutrition needs are higher at a time when you don't feel like eating. So a few ideas to help there. Does anyone else have anything that's worked for them when appetite hasn't been great, or anything they want to share about low appetite? Okay, I'm going to talk about fatigue next here, just because it's so common for a variety of different treatments. Fatigue can be really common. Of course, makes meal planning, grocery shopping, and cooking such a challenge. So I do have a few tips for you, but I understand, yeah, it's a big challenge. So keeping pre-made meals or convenience foods at home, whether it's even things like frozen, canned, or pre-prepared, maybe vegetables, so that you know that part's taken care of. Preparing the meal in stages can help. So when you're very fatigued, maybe you're yeah, planning out your day, your supper meal earlier in the day and preparing that meal in stages. Maybe you are sitting on a chair or a stool when you're doing any chopping or cooking or stirring to conserve some energy that way. If friends or family are asking, oh, how can I help? What can I do? Maybe giving them a grocery list or a few meals that you know you tolerate that they could maybe prepare for you or do the shopping for could be really helpful. So consider that if you've got a people you can ask for help. If there are days or hours when you have better energy and you are doing some cooking, if you can make extra to freeze in maybe individual portions, that can be a bit of help, in preparation for a time when you know you're not going to be feeling well. There are plenty of, one pot recipes where you're not you're kind of throwing everything into one, whether it's sheet pan recipes or even crock pot meals, where it is just a bit less overwhelming. Depending on where you're at, there's definitely community programs. So whether that is, I'm thinking about grocery delivery, grocery pickup, meal delivery. If you're in a major city, programs like Meals on Wheels is common. I know in Edmonton we have Meals on Wheels, Heart to Home, Simply Supper. So different meal options where you are getting deliveries of pre-prepared meals, hot or frozen. Meal preparation kits. You've probably heard of things like Chef's Plate or HelloFresh, where you're getting the pre-portioned, usually pre-chopped groceries delivered, and you are putting those foods together at home. But they've taken the grocery shopping and some of the prep out of the way, and then you don't have to think about recipes even. They've got that all included. Restaurant pickup, restaurant delivery. So considering things like meal delivery apps like Skip the Dishes, just to kind of cut that out where you don't even have to go and pick it up. So if fatigue is really a concern, those are a few options there. I know in Alberta we have you can call 211 to find out what supports are available in your community. And then I do have a great handout called Cooking When You Have Low Energy that I can send out. And if you're in Alberta, we have a cooking class. It's called Cooking When Fatigued. That's virtual or in person that we can get you signed up for. But yeah, you do have to be in Alberta for that one. Nausea, another common side effect that patients tell me about. So we know that nausea is best managed proactively, doing things ahead of time if you can to lower your chances of becoming nauseous. That includes taking the prescribed medications regularly, proactively, instead of maybe at the onset of nausea. So, and then knowing that if the prescription medications that you've been given for nausea aren't helping, to let your team know, because there are a variety of nausea medications that work in a bit of a different way that can be tried. Because once you do get one that works for you, we know that they work really well. So having that medication as prescribed. Again, drinking enough fluids comes up. We know that if you are dehydrated, nausea can be worse. So making sure you're hydrated overall, but then do consider the timing of your fluids. If you're drinking many cups of water at once, right with your meal, you can actually be more nauseous. So if that's an issue for you, you can try drinking 30 to 60 minutes before and after your meal, and then just sips of fluid with your meal is fine. But it's more the issue of your stomach being full of water, and then you're trying to put food on top, and that kind of sloshing sensation. One, you're already a bit too full because you've got all that fluid in there, but the nausea can be worse with a lot of fluid while you're having your meal all in there at the same time trying to digest. So spacing that out a bit if you're noticing that's a problem for you. If nausea is an issue, having small, frequent snacks and meals, that's come up again. Eating slowly can help. If there's a time of day when your appetite is better, again, capitalizing on that. If you notice that smells are bothering you, choosing foods with less aroma, that tends to be colder or cool foods. We know that hot foods give off, you have that steam, there's going to be a lot more smell with a warmer hot food. So maybe you're choosing more often maybe having something like sandwiches or smoothies, and then eating in a well ventilated area. If smells are bothering you, I know people will open up a window if they can, get the fan going away from them. So we do have some more tips coming up here too on if smells are bothering you. And then for some people, they need to avoid foods that are overly sweet or greasy or spicy. That can make nausea worse for them. But bit of trial and error there to know what works for you and what doesn't. Okay, this one comes up a lot too, is taste changes. I don't know if anyone's experiencing this. I know after stem cell transplant, taste changes is really common. So again, it's a time where we're telling you, you need more nutrition, you need more protein, but things aren't tasting like they should. It can be a big challenge. So I did mention that we have a great handout with ideas for each of these. If food is tasting too bitter, bland, metallic, sweet, or salty, strategies to work around those. I do want to mention good mouth care is our start. So making sure that you are brushing, rinsing, even brushing your tongue when you do brush your teeth morning and night. That can definitely be helpful. Mouth rinses, for example, using club soda before and after a meal, or a bit of baking soda in water or salt water. Rinsing your mouth can help clear the palate, get the saliva moving a little bit. If you're having longer term taste changes, you can ask your team about starting a zinc supplement. So this would just be over the counter. We recommend 30 to 50 milligrams once daily of a zinc supplement, and for no longer than 3 months. So you would know within the first few weeks if it was helpful for you. So that's something to consider. And then really a lot of trial and error with taste changes. So playing around with different fats, acids, salt, and sweet flavors, essentially to try to alter the way the food is tasting to you. So if things are especially bitter, could you try adding, tart or acidic flavors such as lemon? Um, when things are more bland, adding, of course, extra maybe seasonings, spices, eating a mix of textures can be helpful as well when things are overly bland. So each bite is a different texture to see if that makes a difference. Smelling your food before taking a bite when things are bland, because we know the smell is a big part of taste. If your food is metallic, consider trying, plastic cutlery, maybe glass cookware instead of metal. If meats taste especially metallic, making sure that meat is marinated or using your meat in a mixed dish can be helpful. And then tart flavors can help mask that metallic taste. So whether you're using things like dill pickles, relish, cranberry sauce, chutneys, barbecue sauce to help with that metallic taste. If food is tasting too salty, of course, trying cooking without salt, avoiding processed foods, those foods that have added salts or naturally occurring salts in them, using different herbs and spices, or even a pinch of sugar to your foods to help counteract that saltiness. When food is too sweet, opposite, can we try adding something that's a bit salty, sour, or acidic, using different herbs or spices to make things more savory? Maybe you're diluting sweet drinks with milk or ice. I know if people are trying to drink some of the nutrition supplement drinks like Ensure, I hear they tell me, oh, they're too sweet. So could we try diluting them to see if that helps? And then food at room temperature or cold when they're too sweet, it is helpful. Any questions about taste changes or anything that's worked for you? I know it's, like I said, it's pretty individualized, a lot of trial and error that goes with taste changes. And for most people, it is going to improve with time. It is just going to take more time away from treatment, away from your transplant date for that to improve. But I'm going to talk about dry mouth here on the next slide, just because that does tie in with taste as well. So if your mouth is overly dry, you're not getting that movement of taste buds the movement of saliva over the taste buds. So do consider a few of these suggestions too, and asking your team if there's anything you should be doing for dry mouth, because that ties in with your taste. So again, good oral hygiene, brushing, rinsing the teeth, the tongue. If you have really thick saliva, there are we call SLS-free toothpaste, such as children's toothpaste like Pro Enamel, that is helpful for that. Again, rinsing your mouth before and after meals. Maybe it's a bit of a teaspoon of baking soda into a cup of water, or just club soda. Overall, staying hydrated, of course. So again, getting at least those 8 cups of fluid in a day. And then there's lots of products on the market that can be helpful. If you've ever seen some of the sugar-free gums are xylitol based. If you've seen Pure gum before, PUR, they should do a gum, a mint, Xylamelts. If you've heard of that before, it's a xylitol base, it's a sugar alcohol that naturally helps bring out saliva in the mouth. A Xylamelt is just a tab that goes on your gums here overnight. that can be really helpful if dry mouth overnight is an issue for you. Some people find chewing on ice chips or having citrus fruit can be helpful for dry mouth. When you are having your meals, maybe you're using kind of adding more moisture to those meals, sauces, gravies, salad dressings, oil, even to see if that helps, per bite. Snacking on frozen fruit can be helpful, things like berries or grapes or peaches. Popsicles can help too. And then just relying maybe more on soft, moist foods if you need to, if you're finding everything is dry. So that can be tricky too. Other options, I know I mentioned the xylitol products, but if you've ever heard of biotin before, that's an artificial saliva. That product, they do a rinse, a spray, a gel. So that can be helpful. It's definitely temporary relief, but it can be helpful. Keeping the lips moist, so you may be using lip balm. Yes, anything that's lanolin based can be helpful as well. And then you can ask your pharmacist too about options for these types of gels, sprays, salivas, balms, to see if they have suggestions. And then a thick saliva, I don't hear so much from people. I did mention that the toothpaste, but again, the rinsing and gargling with the club soda can be helpful to cut through thick saliva as well. Smell changes directly ties in with what we've been talking about here, whether it's the taste or dryness. So just a few ideas, and I have a picture there of that handout that gives both ideas for taste and managing smell changes. So choosing what smells and looks appealing to you can be helpful, and that might be different than your normal. It might be something that you wouldn't normally eat at that time of day or even normally eat at all. But if it interests you, it's worth a try. Eating foods that are cold or room temperature, I mentioned that being helpful before versus warm or hot foods. Cooking with a fan on or by an open window. If you need to use covered pots or pans to avoid the smells there, if you're the one in the kitchen doing the cooking. If you can ask friends or family to help with cooking or drop off prepared meals so that those smells aren't in your house, that of course would be a bonus. If you're finding drinks, the smell is bothering you, you could use a cup with a lid and a straw to help bypass some of that. If it's possible to eat away from where the food was prepared or in another room, of course, helpful. And then some people will use things like essential oils, for example, citrus, to help mask any unpleasant smells. Okay, so we do have some time here, so I might talk about bowels, unless there's any other side effects anyone wants to talk about. So I've got constipation, diarrhea on my list here too, and I think we have time for it.
Yeah, let's go for it.
Okay, okay, perfect. So constipation, there's many potential causes of constipation, with the most common being anti-nausea medications or pain medications like morphine or Tylenol 3 or codeine, causing the bowels to slow down, end up with constipation. So when constipation is a result of medications, you do need a bowel medication to help get those bowels moving again. So often getting enough fluid and fiber just isn't enough if it is medication related, the reason why your bowels are slow. So we know that constipation may result in, feeling really full, which means decreased food intake and can contribute to malnutrition and ongoing poor intake or appetite. If you've had a drastic diet change, let's say you're only tolerating fluids, you might need to add extra fiber by doing things like blending fruits or vegetables or even oats into smoothies, or take a fiber supplement. So if you are taking a fiber supplement, just be aware that you're also increasing your fluids in your diet too. Overall, actually, if you're trying to get more fiber in your diet, make sure you're also boosting your fluids as well to keep everything soft and moving. So again, that 2 to 3 liters of fluid every day, slowly increasing fiber at the same time if you're noticing you're not getting enough in your diet and you think it's contributing to slower bowels. Some physical activity, of course, can help. And then consulting your team about what we call a bowel routine, whether that is, stool softeners or laxatives to help keep those bowels moving, especially, like I said, if you are on a pain medication or some of the anti-nausea medications. Zofran or ondansetron is the most common one we see that slows the bowels. So, any questions about bowel medications or constipation?
I was just wondering about over-the-counter products for that. Would you advise
Mhm.
against those versus
Yeah,
talking to your doctor about prescription ones?
yeah. Our groups here, when you talk to the nurses, they recommend Laxaday or Restore-Lax. The product is PEG, P-E-G, but it comes in a few different names, Clear Lax. So that is safe to be taken. And it is a powder that you stir into any liquid, cold, hot, room temperature, and well tolerated. But do let your team know if you're having issues with constipation because they'd be the ones that gave you the recommendations for something stronger. So let's say you were doing your Laxaday or Restore-Lax twice a day and no bowel movement by day 3 or 4, the nurses want you starting something stronger like Senecot, which actually helps move the stool through your system and clear you out so that you're not going that day 3 or day 4 without a bowel movement. Mhm. Yeah. Okay, I'm going to talk about loose bowel movements next. So diarrhea. We know that diarrhea can cause nutrient and electrolyte losses from the body and can lead to dehydration and malnutrition. So definitely let your team know if you're having any diarrhea because they want to find out the cause. So if you are having diarrhea, in addition to letting your cancer care team know that that's an issue for you, when you're at home, choosing small, frequent meals, so less digestion at once to happen, making sure you're getting at least your 2 liters of fluid every day. But we want half of those fluids to be electrolyte containing if you are having diarrhea. So what does that mean? I mentioned things like Gatorade before or Pedialyte. You could be doing soup broth, vegetable juices like tomato or V8 juices to get extra potassium in. Fruit juices are helpful for that. I would just dilute them a bit because anything that's too high in sugar can cause diarrhea to be worse. So we don't recommend you do any pop. Again, if you're doing juice, diluting it with by maybe a cup of juice and about a quarter cup of water. And you may require an electrolyte, like an additional electrolyte, maybe powder as well. Or if you just prefer that taste-wise versus doing soup broths, that's an option too. And then food-wise, we know that anything that has caffeine in it is a bowel irritant. So limiting your tea or coffee. Pops that have caffeine, of course. Spicy food is an irritant to the bowels as well. Anything that's deep fried or overly greasy or fatty should be avoided if you have diarrhea. I mentioned sugary drinks already to be avoided. And then roughage fiber. So what I mean by that is your green leafy vegetables. If you think of the strands in celery, that's just roughage. If your bowels are already irritated or inflamed, that's going to cause more irritation. So you're going to be doing more of the soft cooked vegetables, your fruits maybe without the skins or the seeds to help reduce any issues if that's already going on with the bowel. So it's not that those foods cause diarrhea, but they can make them worse. So I'll talk a little bit more about fiber here and diarrhea. So there's certain fibers that are listed here that can help with when the bowels are loose. So we call this soluble fiber. This is the fiber that binds extra fluid in the gut to provide a bit of bulk to the stool to slow down how fast that stool is moving through your system. Anything that's oat-based is going to help do that. So whether you're doing oatmeal or oat-based muffins, see pictures here of peeled fruit. So if you're having apples or pears, just taking the peel off while your bowels are upset. Bananas are great. Avocados are great. Cooked carrots, another one. Smooth peanut butter. I mentioned banana, but banana flakes is something on the market that you can buy, and we have those in hospital as well. Canned, fresh, or frozen options like frozen fruits, canned carrots, and get potatoes on there. So anything potato based without the skin again can all help just gel things up a bit and slow down the bowels. And then the opposite there, the good fiber for bowels is for when that diarrhea is happening is that soluble fiber. The opposite is the insoluble fiber, which can make diarrhea worse, that insoluble fiber or roughage fiber. So anything that's, the seeds and skins of your fruit and vegetables, brown rice or wild rice, is going to be less tolerated than something like white rice when your bowels are irritated. So just keep that in mind. A lot of foods have a mix of soluble and insoluble, things like your beans or lentils. So just considering the amounts you're having of those, if you are having beans or lentils, just having them in a smaller amount overall. And then once diarrhea has resolved, we want you to return to your regular way of eating. All fiber is awesome. You don't need to be limiting your fiber when bowels are normal. Any questions about fiber, bowels, or side effects overall before I jump into our common questions section?
I have one question.
Mhm.
Um, you mentioned coffee as an irritant to the bowel. Can you avoid that by drinking, or well, and tea, by drinking decaffeinated coffee and tea?
Yeah, you're right, because it truly is just the caffeine that's the irritant. Yeah,
Okay. Yeah,
yeah.
thanks. Don't see any other
Okay.
questions.
Okay. So these are common questions I got. And then when Fiona asked me about our presentation, she also a few questions came from the participants as well, from the crowd here today. So I hope it answers some of your questions. And if not, please feel free to stay on and ask your questions or send us a chat message. So common questions I get is, do I need to follow an immunocompromised diet? So we should all be following good food safety guidelines, just including things like washing our hands before, preparing food or eating, rinsing our fruit and vegetables before we're eating them. So just under cool running water, cooking our meats to proper temperatures, limiting any cross-contamination between things like raw meats and our ready-to-eat foods in the kitchen. So that's something we should all be following is good food safety. When it comes to patients that have low neutrophil and white blood cell counts or that are immunocompromised, maybe they're on an immunosuppressive medication like cyclosporin, there are additional guidelines that Health Canada has in place to make sure that to help reduce the risk of any foodborne illness. So we can go through what some of those are as well. They can be a bit restrictive. So it's a gray area on how strict you have to be with it, and your team often gives you guidance on how strict they want you to be with those guidelines. So you might have been told you need to do things like cook the egg yolk when you're having eggs until it's firm. So no undercooked or raw eggs would be that immunocompromised type diet. Avoiding raw sprouts, avoiding all raw seafood. Those are common the Health Canada guidelines examples anyway. When you're having things like dairy, having pasteurized dairy, except for hard cheeses, it can be unpasteurized or pasteurized. But for the rest of us, we don't. If you're not immunocompromised, your white blood cell and neutrophil counts are normal, you're not on an immunosuppressive medication, you could have, unpasteurized soft cheese would be fine. So, but it's higher risk if you're immunocompromised for getting a foodborne illness. So I do have, don't know if it's something the group is interested in, but I can pull up the the Health Canada website here. I think you can probably only see a portion of it, sorry, but I have the link. It is Health Canada eating guidelines for immunocompromised diet. Should be able to see that there. So if this is the safe food alternatives for immunocompromised individuals is the title there. And I can send out the link, but has foods to avoid and then safer alternatives. So you can take a look there. I mentioned the eggs, raw seafood, but then what can you have? So, cooked seafood, cooked to a safe internal temperature. It lists those. It talks about smoked seafood in cans, or any seafood that does not need to be refrigerated until it's open. So, right, if you buy it in the pantry section at the grocery store in the can, that would be safe to have. But the refrigerated smoked seafood would not be. That would be higher risk. So just a few examples there. I think most of us would be having, our milk will be pasteurized unless you're on a farm and drinking it right from the farm. But if you are, let's say, at farmers markets and you're having unpasteurized fruit juices, and you're immunocompromised, we'd want you to avoid that. Just having regular pasteurized fruit juice from the grocery store is what we'd recommend. I just wanted to pull that up because it's a very, very common question I get. And I'll pull this back up. Sorry if it's a bit wonky on the screen for you. Okay. just wanted to show you that. And like I said, we can send out the link, but that's through Health Canada, that pamphlet for the safe alternatives and foods to avoid if you're immunocompromised. Next topic on there, iron overload. So if you've been told your iron is too high, you're needing phlebotomies. I often get questions, do I need to limit the iron in my diet? So no, you don't need to overly restrict iron-rich foods. Although if someone was to tell me they were eating liver, 3 times a week, I would want them to cut back, knowing that liver is very high in iron and very available iron as well. You're going to absorb that too well. But that is really not the case for most people. But so I would say the answer is no, you don't need to restrict your iron-rich foods. We know that reducing iron-rich foods hasn't been shown to reduce the ferritin levels in your blood, and you can actually become deficient in other nutrients such as zinc if you're really restricting your diet. You do need to avoid any supplements with iron in them if you have iron overload. For example, if you are going to take a multivitamin, we would get you to choose the low or no iron multivitamins. So take a look if do have a multivitamin. Often our men's 50 plus multivitamins are low or no iron, and low is 2 milligrams of iron per day or per pill. Usually they're 1 a day pills or less. So 0 to 2 milligrams would be acceptable. Anything over than that in a multivitamin, we'd get you to switch multivitamins. And then check any other supplements or powders maybe that you use. Maybe it's a protein powder or a greens powder, just to make sure that it's not high in iron as well. Sometimes they sneak those things in with other vitamins and minerals. So again, less than 2 milligrams per serving in any powders or supplements you're using. And then it's generally recommended to avoid an individual vitamin C supplement because we know in an individual form, you're going to get a lot more vitamin C than you would in a multivitamin or through your diet. And vitamin C does help absorb iron from the diet. So no individual vitamin C supplement if this category applies to you. Any questions about iron overload or the ferritin numbers or iron-rich foods? You can always ask after as well. And then common question here, foods to boost your blood counts. So there is no one food or nutrient that you need to eat or include to boost your blood counts. Overall, getting enough calories with a focus on protein is most important. So your body requires protein to rebuild healthy blood cells. It'll pull from the muscles if you're not able to eat enough. That's why that focuses on protein so much. And then for good variety in the diet. So I mentioned those different colors in our fruit and vegetables or plant foods, really, more than just fruit or vegetables to be helpful. And then I also want to mention that there's so much nutrition information available to us now, and you might get suggestions to avoid certain foods, follow a special diet, take a certain supplement. But there is no one food or supplement that will cure cancer. Eating a variety of foods, of course, helps get our immune boosting nutrients. So get enough zinc, get enough B vitamins, in addition to getting enough calories and protein overall, like I mentioned. So I hope that answers some of the common questions that I get and that Fiona had sent ahead of time too. But we have about 5 minutes left, and I've got more time after that too. If anyone wants to stay on with questions or would like specific links sent to them, please let me know. If you do want to get connected with a dietitian, I can definitely help you if you're in Alberta, but if you're outside Alberta, asking your healthcare team for a referral and as a good starting point, or let me know if you're having a struggle connecting with a dietitian, and I can always try to help you out too. I know in Alberta, even calling our HealthLink line 811 will get you connected to a dietitian. So that's a starting place anyway if you aren't connected with someone through your family doctor or your cancer clinic. But that's all I have for you. So thanks, Fiona, for inviting me to speak today. And yeah, we have a few minutes left if anyone wants to
Yeah.
stay on.
Thank you. We do have one question here that I'll just read. I've been told to avoid grapefruit and Seville oranges. Do you know what the issue with those is?
Yeah, likely that would be one of the medications like tacrolimus or any cardiac or heart medication. It can just change the absorption of those medications. So I can't remember. It might be one or both of those medications are not sure which category exactly, but yeah, unfortunately those are tricky ones to, especially if you enjoy grapefruit. But yeah, there's no alternatives there. So pharmacies are great ones that will tell you when that restriction can stop. So connect with a pharmacist too if you have more questions on that. But that will be more medication related.
Great, thank you. You can also raise your hand. Click the raise your hand button if you would like me to unmute you, and you can just ask your question. Um, I had one. Oh, I just wanted to comment on you were talking about the fresh prep or similar, programs that deliver a meal that you can cook. I've known a few people to use that, and almost everyone says they get two meals out of, what they charge as one meal. So you may find they're expensive when you first look at it, but it seems like they're pretty big portions. Most people
Okay.
most people are
Yeah.
splitting those into two meals. So I just thought I'd mention that for people online.
Yeah. Yeah,
Yeah.
that's good to know. And then you don't have the food waste that goes with it too.
Yeah, yeah. And you can cut out the grocery shopping too.
Yeah. Yeah, absolutely.
And just a question about dry mouth. Will alcohol-based mouthwashes make that worse?
Yeah, often it will. So we do recommend an alcohol-free mouth rinse.
Okay, yeah,
Yeah.
I thought so. Okay. Anybody else have a question?
Just click to my websites for
Oh,
anyone looking.
great. Yeah,
And I
thank
can send these to Fiona as well.
That'd be
Uh,
great. Yeah, I'm definitely going to check out all your nutrition handouts.
yeah, the
And,
AHS nutrition handouts that go through any of the side effects we talked about today, and then those YouTube videos that I mentioned that also coincide with the side effects. And then I've got the American Institute for Cancer Research has great ideas for reducing cancer risk, which is great information for after treatment as well. I've got healthy recipes. And then Unlock Food is just unlockfood.ca, Dietitians of Canada. They've got some great recipes and ideas as well.
okay, excellent. Well, thank you so much for Jenna for all this great information, very informative webinar, and lots we can follow up with afterwards and maybe feature some of these links in our newsletter too.
Yeah, great. Well, thank you
Yeah.
so much for having me and for sending some questions ahead of time. That's great. Thank you everyone for attending and have a great rest of your day.
Okay, yes, thanks everyone. Enjoy your evening and yeah, check out our website for more resources. Thanks.
Thanks.
Bye-bye.
Bye.